Trauma is such a devastating thing to go through, and especially a burn trauma. So many people say that a burn trauma makes you stronger, but the truth is that a burn trauma is crushing. It just crushes the life out of you and changes everything for you. I was burned in Buffalo, New York, and I was working as an electrical apprentice. I was directed to cut into a high voltage power line, so that power line was still live. I was hit with 21,900 volts of power, direct from the power company.
I think the thing that sets our burn center apart is that despite the verified burn centers shrinking in this country, our burn center has maintained and grown, actually, during the last 10 years.
A trauma center, and especially the burn unit, is like an insurance policy that if tragedy strikes, you know that this is here, and the best care that you can possibly get is here. You just never know when it's going to be you or your loved one.
We provide the comprehensive care from the acute event to rehab, recovery, and reconstruction. The people that think they have minor injuries and try to care for them themselves and then end up needing our services because they become complicated. And then people that have injuries from grill explosions, bonfires, steam burns in their house. And our third group of patients are really critical care needs, big devastating injuries. These are usually people that are in structural fires, explosions, even patients that might get struck by lightning. I think philanthropy is really important in all burn care activities because the most devastating injuries usually happen to people who aren't prepared.
In 2015 of October, I was cooking dinner and I had 2 pan butter sprays in between the burners, and they had been there for a while. As I was cooking, the more heat there was, the bottles just began to just absorb the heat. And it wasn't just one, it was 2. I remember that the 2 bottles exploded. When they exploded, it caused the fire to just burst out. I used my hands to put out the fire, and so that's where my arms got burned, 2nd and 3rd degree.
In adults, the most common injury is flame burn or exposed to burning combustible items, which is different from pediatric injuries in that the majority of pediatric burns are scald. Every year there are 4 or 5 types of injuries that I see for the first time.
I'm a volunteer here in the burn unit. When I see a patient come in struggling in the bed with pain and wounds, it just brings back everything that I've been through because I spent time in that bed and I identify with it completely. But when I see that patient heal and go home, it just reassures me that, yes, not only I did it, but people are still doing it with the right support.
I fully renovated OR space, which is one of the things that sets our burn center apart from others, is that we actually have an operating room in our ICU, and that'll have heat that's fully regulated, because when we do surgery on patients that are missing a lot of their skin, they become hypothermic very quickly. Without philanthropy and donors' support, getting the burn center through to the next level would be impossible. The amount of investment that's needed, I think, needs to be both internal and external to make sure that we can get the most advanced renovations and stuff done in a timeline that doesn't put the hospital behind in throughput.
Knowing that people would like to support the burn unit and contribute to that cause just fills my heart with pride for our community.
When I think about the new renovation, I think about people feeling at home. I think that the patients will feel more love.
I would like to say to all of our donors for the burn unit that your contributions are just so appreciated. by the staff and especially by the patients who will be treated here.
Philanthropy makes an impact on everything that we do here at the Burn Center, and it's going to be even more important as we finish the renovation, move on to phase 2, and continue to advance burn care.
Because if I was here before the renovations and I felt amazing and I loved it, I can just imagine the top care, the priority that they will have now with these new opportunities, these new resources that they will have. They're investing in something amazing and something great.